Perineal care. The purpose of perineal care for male and female are the following: to promote comfort and cleanliness, to promote healing after surgery of childbirth, to prevent infection with the client with an indwelling. Before we start the procedure, we have to assess our client for the presence of irritation, excoriation, inflammation, swelling, excessive discharge, odor, pain or discomfort, urinary or fecal incontinence, recent rectal or perineal surgery, indwelling catheter. But before we start the procedure, we must have to assemble our equipment and supplies, like the following: the bath towels, the bed blanket, the washcloths, gloves, wash basin with water, the liquid soap, the bed protector, and the bed pan. Now we have to position the bed and the client appropriately. We have to lower the side rails to the side which I will be working on. The opposite side rails is up and secure. While my patient is lying on her back, I'm going to put a bath blanket Can you please hold and grab the top of the blanket? I'm going to pull down the top sheet cover to the foot of the bed. After that, I'm going to wash my hands. Okay. Put on my disposable gloves. And the other one. Okay. Just maneuvering my fingers to advance there. Okay. Now, I'm going to fill the basin with water, but I have here a basin already with water. I'm going to ask my patient to raise her hips so I can put on the bed protector under the perineal. Ma'am? I'm going to put a bed protector under your perineal. Okay. We have to offer the bedpan to our patient. Okay. If used and the patient is in intake and output, you have to record the amount. Then, you have to empty and clean the bedpan before continuing with the procedure. You have to remove your gloves and discard it accordingly, depending on the policy of the hospital or the facility. Then you have to wash your hands again and put on a new pair of gloves. While the body and legs of my patient are covered by the bed blanket, I'm going to drape the leg by tacking the bottom of the blanket to the side of the inner legs. Okay. Then I'm going to bring the middle portion of the base of the blanket up to the pubic area. Now I'm going to request my patient to separate her legs. Okay. And flex the knees. Okay. I'm going to wet the washcloth. Then make a mitt. Then make a mitt. And put a small liquid soap. Okay. Using my one glove hand, I'm going to stabilize and separate the vulva with the other gloved hands. Then I'm going to proceed on the washing. Using my one glove hand, I'm going to stabilize and separate the vulva with the other glove hand. Then using my soap washcloth, I'm going to apply one downward stroke on the farthest outer labia to the perineum. Then, on the other side, to rinse the washcloth. And make another mitt. So, rinse the outer labia, and the other one downward stroke to the perineum. Using this soap washcloth, I'm going to wash the inner labia and the inner near labia. Then I'm going to rinse the washcloth. Make a mitt. And rinse the area. With my one glove hand, to separate the labia, I'm going to clean the inner part of the vulva to the perineum. I'm going to rinse. And remit again, and remit. Then, going to rinse the vulva to the perineum. Then, I'm going to dry the wash area with a towel. In male perineal care, I'm going to grasp the penis With one hand, I'm going to begin at the meatus and wash in circular motion. If the patient is not circumcised, I'm going to draw the skin, the foreskin back. Be sure that the entire penis is washed. Then, I'm going to continue to wash down the penis and the rest of the perineal area, including the scrotum, using a downward stroke. In working outward the thigh. I'm going to lift the scrotum and wash the perineum. I'm going to rinse the washcloth and remake a mitt. Going to rinse the urethral and the perineal area as well. Working on some direction until the internal area are clean and soap-free. I'm going to dry the wash area with a towel. Ma'am, I'm going to turn you on your side. I'm going to flex your legs. The upper leg is slightly higher. I'm going to make a mitt. Apply soap slightly. I'm going to expose the anal area. I'm going to wash the area, stroking from the perineum to the coccyx, front to back. Then wash the buttocks. I'm going to rinse in the same manner. And I'm going to dry the area carefully. Now I'm going to return my patient to her back. Returning the patient to her back, I'm going to remove and dispose the bed protector according to the policy of the hospital. I'm going to cover the patient with a bed blanket. I'm going to remove my gloves according to the policy of the hospital. I'm going to remove, fold, and store the bed blanket according to the policy of the hospital, and replace the top cover. Okay. Tuck them under the mattress. Then I'm going to put up the side rails. After putting up the side rail, I'm going to carry out the procedure completion action. Put the call light of my patient. Put everything beside her. That's it.